transfemoral, you need 2 6-inch bandages and 1 4-inch bandage. So that means you're going to need at least 6 pieces of tape to start off with. You're going to start with the 6-inch bandage. The 2 6-inch bandages are going to be very, very similar in what they do. Somebody to take their tape off. All right, so you're going to start fairly high in the groin for the first 6-inch bandage. With that being said, watch your hand placement. We're good here, but I'm just saying, out in the real world, watch your hand placement. You're very close to a sensitive area. Plus, the other thing is, you'll see as we go through, we're going to go around the residual limb and around the waist to anchor, around the residual limb, around the waist. If the patient was wearing underwear, you have now just wrapped their underwear to them. So if they ever need to go to the bathroom, that's not going to happen. So the patient's not going to have on underwear. So I'm just saying, take all this into consideration, okay? So you're going to start fairly high in the groin. You've got to stay high in the groin because what happens is people don't want to get so close in the groin and they don't come up high enough, and then fluid can start to pocket in through here. And then it's called an adductor roll. And then when it does come time to get fitted with a prosthesis, they've got this extra bunch of skin and fluid here, and that's not going to be comfortable. Everyone's like, exactly. So we don't want that to happen. So you're going to start right in line with sort of the inguinal line there. Come down over the outside corner. And this one's nice because you come right back over your starting point right from the beginning. So now you don't have to worry about holding that on. So a little pressure down through here. Then we could have our patient side lie. We're going to anchor around the waist. So again, we're now just kind of laying it down right on top. I'm just kind of unrolling it right on the skin. I'm not really pulling a whole lot. You're going to come back over towards this hip, and then you're going to come down the back side of the leg again. Make sure you're not, again, getting too close to the buttocks there. Mm-hmm. I'm going to take this one, and I'm going to come up as high as I can get through the groin because, again, I don't want that adductor roll to form. And again, your patient can abduct their legs for you, so they can kind of help out with this process. So I'm going to come high up through there, and then you're going to go back up around the hips again. And you should end up, for the most part, most of these bandages are a pretty standard length. You're probably going to end up running out of roll somewhere up in the waist. It can be in the back, the front, the side, but probably somewhere up here in the anchor is where you're going to run out of wrap. So we're going to tape that down there. Patient. All right, so with our next 6-inch bandage, you're going to do the same thing. You follow the same pattern. You're going to go around once around the residual limb, once around the waist, again around the residual limb, and end up probably somewhere in the waist. By the time you get done with your second 6-inch, there should be no skin showing in the residual limb. So you should have all of your holes covered. So I'm going to look and see where I have my holes before I start this one. So I have a fairly big hole down here at the bottom of the residual limb, and just a little tiny sliver over here. I've found from doing this, it's easier to cover up this little side hole if you have one over here to start versus trying to cover up this big one right away. I'll get to it. So to cover up this one, I'm actually going to start a little bit higher this time, but still at the same angle, still in kind of the same place. So I'm going to come down over here, over the outside corner, up over the inside. Make sure your corners of where you started from get covered. If that's left out, it doesn't take very much for that to snag on something and it starts to unravel everything that's been done. So make sure those get covered. And then you'll have your patient side lie, lay this around the waist. Now I'm going to come down and I'm going to kind of exaggerate this angle a little bit because I really want to be able to come up. I don't like that. I'm going to roll it back a little. So you can do this during a comp, it's fine. We're going to end up here. All right, so now smooth out the wrinkles. Nice and loose up there. And we should have everything covered down here. All right, so everything's covered. Now what we're gonna do with the 4-inch is we're just gonna apply more pressure. Okay, so the main job with 6-inch, yes, more pressure down here, not so much up here, but coverage. Get full coverage with your 6 inches. Now with my 4-inch, I'm just gonna basket weave and I'm gonna add more pressure to help encourage fluid return. Start right on the front for this. It's gonna make it easier for you. Come down over one corner, up over the other, cover up where you started, and come straight through the back. That's your figure 8. All right, if you keep doing this, just repeat that pattern. Corner to corner, and then across the back. You should see this little basket weave starting. When you get towards the very bottom, it gets a little harder because you don't have as much, you're running out of angle to kind of play with here. All right, so we're gonna end up, I'm gonna have the person roll over because it's good for them to land prone or side lying anyway. And we're gonna tape off. So this one turned out a little bit better than the last one. I've got no holes. I would ideally like a little more coverage down here, but you've got everything covered with bandages so you're not gonna have any fluid, and you've got some pressure build up through here to help encourage the fluid return. So again, we're gonna look for wrinkles, we're gonna look for coverage, we're gonna look for tightness up here versus down here. Does it feel fairly evenly distributed? Those are the major things, okay? Any questions about that?
For the first one, what type of bandages do you use? Like what size?
2 4s.
Right.
2 4-inch bandages for the transtibial, 2 6s and 1 4 for the transfemoral. For the comp, you will have one or the other. You won't know until you come in. It'll be Professor Bauer and I, we usually just sit on opposite sides of the room. Everyone will be in here. You'll choose, and it's not a scenario, it says transtibial, transfemoral. You don't have to introduce yourself or talk to the simulator. You have, there's no chart. So we just, 20 bonus points right there just for coming in and picking a scenario. You will have one or the other, but you won't know which one you have until you come in and draw the paper. So you have to be prepared for both. You have 10 minutes. The more you practice, the faster you get at this. I will tell you, when you go start to practice now, it's going to take you a lot longer to do